Call this meeting of the Consolidated Board of Health and Human Services to order, please. And we also have with us tonight Karen Brantley, who is a member of the Health Advisory Board. Commissioners, you have your agenda. Do I have an approval on the agenda?
Chairman Robinson. Cindy Taylor's also here. She's a member of the Health Advisory Committee.
Who is?
Cindy Taylor.
Oh, Cindy Taylor is also a member of that board?
Mm-hmm.
Welcome, Cindy. See her. Okay, do I hear for approval of the agenda?
Move to approve the agenda.
Motion by Commissioner Matheny. Do I have a second?
Second.
Second by Commissioner Mack. Any questions or concerns? Okay, the agenda has been approved. Do we have anybody to speak in the public forum? I don't have any names up here. Misty, you have anybody? Okay, anybody here to speak in the public forum? Okay, if not, we're gonna move over to that. Okay, our consent agenda.
Move to approve the consent agenda.
I have a move by Commissioner Henson to approve the consent agenda. Do I have a second?
Second.
Second by Commissioner Mack. All in favor?
Aye.
Okay, any opposed? Consent agenda is approved. Now we'll call on Ms. Baldwin to present her report from the Health Department. Mary Perez Baldwin. First, it looks like we're going to hear about COVID-19.
Say good evening to everyone.
Good evening.
In your packet, I just, as noted, there's not a budget summary until the budget is approved, but I did put in our record of accounts receivable. Just for your review. We had a total of 37 accounts that were written off. That's really the highlight of it. Is there any questions about that? Now, if they come back in and get services that they return, then we open their bill back up. The next thing in your packet was the activity report. And this is a report for all of the programs, all of our clinics. And as you can tell, the very first line is the clinic and its percent of kept appointments. We kind of stayed steady with the appointments that were kept. We did a total of 75 clinics in-house, well, telehealth included, for the month of June. We haven't done July yet. We had 160 visits in June, and that not only includes the ones that had to come in, like our maternity patients, third trimester maternity patients, our child health patients, some had to come in, immunizations, that kind of thing, but also some family planning and quite a few telehealth were included in this. But as you see in April, our daily average slowly started decreasing, as did our new patients in family planning. So because of COVID, I'll just say that to sum it up, that our clinic average decreased overall because of COVID. Any questions on that? I did put the newsletter in there for your review. We were just running a little bit behind. It didn't come out until this month. So we try to do it monthly and send it out to our community partners, as well as share it with our patients who have given us their email address. Any questions? Okay. Keep moving. Okay, let's talk about some COVID. I went around and left you all a copy of the little packet with the data. So, total lab confirmed positive cases, and this not only includes what we received or what we've done at the health department, but also all the testing that's been positive from all the providers, not only in our county, but if they're tested outside our county and live in our county, then their results come to us as well. So that's 849. We've had 17 deaths in our county as of today. We've had a total of 609 people that have recovered from COVID. Right now we have 10 that are hospitalized. We have 223 that are under isolation, and we've had 45 new cases since the last time I updated this. Well, it was updated last week. We've had 45 new cases. If you go to the next page, there is a running graph of the daily new lab confirmed cases. You can see where it peaked kind of in July, and then it kind of decreased, but it looks like it's staying kind of stable right now in August. Again, the median age range for the most number of cases are 25 to 49-year-olds. Those are our working group. They're out in the field working. That's at 40%. Then we have the 50 to 64-year-olds at 22%. And believe it or not, age 0 to 17, the children are higher than the 18 to 24 and those over 65. So we're having a lot of children now that are being exposed. We've had some as young as 1 month old who have COVID. The gender range has changed. At one time, the male was leading in percentage, but now it's the females, 55%, 45% male. The Hispanic ethnicity is still high, 47%. White is 38%, African American is 13%, Asian is 2%, and American Indian was 0.1%. So we actually had one that we know of that tested positive that was American Indian. The next sheet is, this is our latest update since 12 o'clock today, excuse me. And it just pretty much shows you what I spoke about earlier about the cases. And then it's just graphed out. And it does show you how it's climbed since March to where we are now. And the last handout that I have is on our drive-through testing. So since June 1st of 2020, we've had a 17% positive rate. You can see that the negatives 82.3%, positives are 17.0%, and we only have 0.7% test pending now. So the lab is actually finally caught up. So we're getting our results back like we were in the beginning. There have been 197 unique positive cases. So when I say unique, that means they've only been tested through our drive-through one time, and only through other providers one time that we're aware of. Drive-through testing results have had a 17% positive rate among unique tests since June 1st, 2020, and that kind of shows you the graph. On that, the next page breaks down the drive-throughs. In Bisco, there's been 290 tests done. Troy's had 278. Mount Gilead had 225. Candor, 216, and Star, 150. Okay, so Bisco drive-through testing site has had the most positive test results. So Bisco had 69, Troy had 52 positive, Candor 47, Star 15, and Mount Gilead 14. Bisco has also had the highest percent of positive rate at 23.8%. Candor followed closely with 21.8%. Troy 18.7%, Star 10%, and Mount Gilead 6.2%. And then the next sheet shows you the number of tests conducted at each site, the number that were negative, and then the number that were positive, and I won't read through those. Are there any questions so far?
What's the, you gave the percentage of positive tests. What's the age range of deaths?
Of deaths?
Yeah.
They're 40 to 88. 40 to 88. I remember that because I had to get that for Dr. Ellis wanted it. So. And on the last page, it's just change in tests completed and results from July 17th, August through August 14th, 2020. And then the number of average drive-through tests has decreased by an average of 14 per day since July 17th, 2020. So in the beginning, it's like everybody wanted a test, and now everybody's kind of like, okay. And I think the main issue with that is because they know if they get tested and they're positive, then they've got this quarantine and isolate, and they just rather not know. That's what I think.
Could be that long thing you stick up their nose. That might help.
Oh, come on, that just tickles a little
Ain't
bit.
that right, Robbie? If a real man, it ain't so bad.
That just tickles a little bit.
Mary, one thing that, we had the town hall meeting last week with Dr. Woodgear, and I think one of the reasons why people were hesitant was because there was up to a 3-week wait, and you were over it before you knew you had it.
Right. You're over it. That's right. You're coming out of isolation. That's true.
So I think that had something to do with it.
Okay, so I just want to mention that we do have some clusters in our county right now that we're dealing with. And a cluster is 2 or more positives in a facility or a business. We have one cluster that involves 23 residents and staff, one that involves 9 residents and includes staff, and one that involves 3 residents and includes staff. So, I can't divulge the names, but anyway, we do have the clusters. So now I know that the last time I spoke to you all about the testing, I mentioned that the state was going to send out testers in all the hot spots throughout North Carolina, and Montgomery County was waiting for a vendor, so we now have a vendor. So what the Department of Health and Human Services has done is they have selected a total of 7 vendors, and they're going to manage over 250 community health workers who will be deployed in 50 targeted counties to connect North Carolinians with not only testing but needed services and support. The community health workers will help the statewide COVID-19 response and help North Carolinians navigate the complex impacts of this pandemic. They will connect with North Carolinians who have been affected by COVID-19 with medical and social support, including the diagnostic testing, primary care, and case management, nutritional assistance, and behavioral health services as well. So right now there are free community testings getting ready to happen. They're going to primarily increase the access of COVID-19 testing for African Americans and Latinx or Hispanic and American Indian communities. Capro, I've never heard of them, but they are the vendor that's going to be serving not only our county, but Mecklenburg, Union, Rowan, Gaston, Cabarrus, and Stanley. Just to tell you a little bit about Capro, they were founded by a physician from the Commonwealth of Pennsylvania Medical Society in 1985, and at the request of the Centers for Medicare and Medicaid Services to serve as the state's quality improvement organization. Capro is a leading provider in the industry of 35 trusted years of experience and deep clinical expertise. So in addition to teams of community health workers, they are going to be the ones that come out into the field and they're going to test in all the counties. So I spoke with someone from the state Friday, and the plan is for them to begin the testing in Candor, and Robbie was gracious enough to find a location for them to test, the old shopping center in Candor. They're going to do 10 to 4 because they want to make sure they get the working crowd too. They're also going to do it on Saturdays so that everybody will have an opportunity. Now, they don't have to just live in Candor. They can live anywhere in Montgomery County, to my knowledge, to go to that site and get tested. Right now, they're saying that they hope that they'll be able to do the testing through December, but I have not got any of that in writing yet. So we'll see what happens with that. One of the greatest concerns we have right now is the difficulty in getting public buy-in for this testing, because these are going to be strangers coming in, and we know how our community can be about people they don't know. So that'll be the hard part. Any questions about the testers? Okay. Because of the numerous outbreaks across North Carolina in nursing home facilities, the state has decided to make it a secretarial order that every nursing home tests their staff and their residents once every 2 weeks. So they're taking care of that. And so if you have anyone that you know that's in a nursing home in North Carolina, they should be getting tested at least once every 2 weeks. I'm sure you all heard about the dog that tested positive for COVID. Everybody heard about that? Okay. I won't talk any more about it then. But they did do an autopsy. Well, not an autopsy. They call it a necropsy, which is the same thing on the dog to determine its health at death. There was a question, I've had a couple of questions come up about alcoholic beverages being served. And that is a executive order, number 153, that restaurants should not be selling any alcoholic beverages after 11. And bars should not be open at all. I don't know if that's being withheld, but I did get a complaint about a restaurant that served drinks. So me and the sheriff have talked about that. There is a child care hotline that's going to be available to help families with school-age children find care. There's a 188 number, and what they do, they will connect families with child care, especially those that have school-age children and they need some care. They said there's about 30,000 slots that are available for school-age children in licensed child care programs across the state. So that's a great thing, because we know that our children aren't going back to school now, and the parents were kind of wondering, what are we going to do, work or not work? So this will help them. But there is a number, and if you know of anybody that needs that number, just let me know. and I'll be glad to share it. The last thing I have is the prison system. We had a little friction with Southern about a week or so ago. We had some officers who had tested positive, and they were kind of being told they had to come to work. But anyways, we got involved with DPS, and long story short, we ended up having a conference call with DPS and the Department of Health and Human Services. And so now we got it straightened out, because we weren't trying to say, you know, you can't do this. We just wanted to make sure that they had everything in place and that they understood the guidance and the importance of not allowing people who were positive and hadn't had their isolation period the length that it should be to go back into that system and possibly infect the inmates there. So we got that straightened out. But anyways, they tested, you know, there was a outreach for all the prisons in North Carolina to test. So they tested a total of 29,062 offenders. Out of that, 619 tested positive. The positivity percentage was 2.1%, which is much lower than prison systems in other states. Southern tested 299. Out of that, only 4 were positive. So that's not bad at all. Any questions?
The 3 clusters that you said that the county had identified, were they nursing home clusters? Are they congregate living? Are you able to?
There's one that is considered a nursing home, the other one's considered a,
So they wouldn't be congregate living category, so you can't disclose anything about that, can you? Okay.
Mary, the surrounding counties name the nursing homes, why can't you name them?
Say what now?
Mecklenburg does, Moore County
Moore County does what now?
names the nursing homes where there's an outbreak.
Well, I can, but I can. Do you want to know? If you want to know, I can name them.
You said you
I'm
couldn't.
pretty sure it's public knowledge anyways. One of them is, the one with the biggest cluster is Sandy Ridge, and the other one is Autumn Care. And then the other one was the youth center, Eckert's.
Really?
Wow.
But they're all under control, everybody's been tested. As a matter of fact, Robbie went out and tested, how many? 17 today. But the state, we were going to go Monday and test Eckert's, and then the state went in during the weekend and did the testing. So their results were back.
Okay.
Have you had any more dialogue with the Hispanic community?
I have not. I have,
They're still the highest. Just wondered if there's any more we could do with them.
well, I think we could try to reach out again. I'm not sure if Yari or the health educators, I know that one of our health educators was going to go with her, and I'm not sure if they have actually gone out to the churches yet. But that was their plan, is to go to individual churches and talk to them.
Okay, thank you.
Any other questions for Mary?
Mary, what's the plans for the flu season? You can't do your usual clinics.
No, we just had a call today, and I didn't get to hear all of it, that had come up here, but my understanding is that they're still going to push the flu vaccine. They're also going to be pushing the vaccine for COVID as well. They're going to be reaching out to CVS to help with that and local providers to help with the COVID vaccine. But yeah, they're really going to push for everybody to get a flu shot as well. That's that. Okay.
Thank you, Mary. And now we'll hear from Stephanie Smith, Director of Social Services.
Good evening, Commissioners. Thank y'all for having me. I know you've been looking at a lot of numbers. And I've already sent you mine, but I do have some explanations for some and maybe to give you some information on what we've been doing for the last couple of months, and specifically COVID. I did send okay, so we'll go to the, well, let me tell you a little bit about it before I'm going to that next, thank you. I sent you a little narrative. We saw a decrease in salary expenditures for the fiscal year, and that is largely due to staff vacancies. And I will, you've heard that today. Also, that means there's a decrease in your benefit expenditures, and also, of course, your reimbursements, because we are reimbursed. A portion of our salaries are reimbursed by the state and federal government based on how we code our day sheets or what our job specifically is. And that ranges from somewhere around 42% to Medicaid workers 75%. So that's the highest amount of reimbursement that we receive. Also, there were several months where we had less court time. So that means our legal services needs were less, and so we had an increase there. And we're just starting to get back out on the road, so our fuel expenditures were down. We still are very careful before we go out. But when we get a call, report for adult services or child welfare that's screened in, we go out based on whatever the time frame we have to get out there. Foster care board payments continue to decrease. We now have 3 foster children in congregate care, and those are the only 3 we have in congregate care. That always costs more, and the only reason I can assure you, I do not believe congregate care is the best way for children to live. They need to be in a family home if it's a foster family home, but due to special needs or behaviors, they're not leveled at that point at this time, but we try to get them there as soon as we can. But that has continued to decrease because we do have a few more beds in this county, and we really have worked to try to build rapport with our surrounding counties to try to get the children in family foster homes. So that has yielded a decrease in spending there. We also, this year, we worked with HR and Finance to move some to retiree benefits going back a number of years, and we were able to see a reimbursement to the county of $174,000. That's 7.5% of our budget. Training costs were up at the beginning of the year. That's come down. I'm scared. I will say that we didn't get a lot of applications, but we have a handful of really good, promising young social workers, and we're going to do our very best to try to keep them. Right now, we're training them, and we just hope at the 2-year period they don't leave us. But I will say that they're good. We continued to train them during COVID because they weren't out as much in the field. In fact, I am now certified as a social worker, so I am actually supervising intake, and I'm doing on-call because we needed some help in our rotation. So I'm not a social worker, but on paper they say I can do these things. So I'm trying to help out some where I can, and it's always good to learn a new trick when you get to be my age. So what we're finding now is out of need, the state had to quickly rewrite their training materials to do this all online. So they do virtual. It is synchronous. It's almost like being in class, and that's what I did. And I really liked that that type of training, because really what we were sending people out 3 weeks, and it costs more training dollars. You've got some of them have to stay overnight. You have cars out. There are times where networking is good in your jobs, but in social work, the kind of work that the intense training they have, it doesn't help a whole lot. So I find this good. Also, we are getting people trained faster. They are able to take us in faster. Now we cannot, when we get a new social worker, as you've heard before from from our Sheriff Watkins. For social workers, the same way. Until they get that certification, that training, they cannot take the first case. So we literally have them shadowing, reading materials, and we had to wait on a spot in class. Now we can get them in there pretty fast. So we're looking at them taking partial caseloads within about 2 months of the time they come in. And that makes a big difference. And we can get some other training done because they're converting about everything now to online training. And that, I hope, continues. Some of the trainers I had did not like it, but I spoke up as the director because of what it means for us getting people out in the field and also saving county dollars, because that's county dollars with that training expense. Okay, so, sorry, Misty. So we're going to look at the service report for the last 2 months. I also added in a middle column, and I like to look for trends. I like 3 years. That's ideal for me. But what I did here was I pulled up. I added July 2019, July 2020 to let you see. Now, of course, those are the numbers for June 2020. But to compare specifically July 2019 to 2020, one of the things that really stands out if you go down, you look at our crisis intervention program, emergency assistance. Did you see the difference from 9,000 July 2019 to July 2020? And the change has been all due to COVID. What's happened is there has just recently been, in the last few days, a moratorium that was lifted on utilities companies could not shut off power to those who had not paid their bills. So that moratorium just ended, but most of the utilities companies have agreed to give people till 9/1 before they will send any cut-off notices. And there is a provision that will allow these people, if some of our clients or some people, individuals in the community, have not paid, they have a 6-month period where they can establish a payment plan to try to catch that up. So what we're looking at in September, we should start seeing a rise in people needing help with their energy. But I wanted to point that out. You're also seeing in adult services, we're starting to see more reports come in. They had gone down a good bit. They're starting to have to get out to address some of those reports now. We have 14 guardianship cases, we call them ward, that the county takes care of, our staff takes care of. They are all in congregate settings, which means they're placed. To date, as of this morning, we have had none to test positive for COVID-19. I'm very, very relieved to hear that. Also, with the family and children's services, our child welfare, we're seeing a slight tick up in reports, as we've seen in adult services. But I'm very happy to see the drop in the number of children in care. Now, there are a lot of reasons for that. That is not all COVID related. We are really working to try to provide resources and keep them in the homes as long as we can. But there are times where we can't do that. And we're going to always think of the child's welfare first. And we're going to follow, of course, statute. We have, of the 3 children in congregate setting, one young middle-aged male had a low-grade temp, and he was tested and he was positive for COVID. He had a conference call with his social worker, wanted to check on him, and he said he didn't know why they said he had COVID because he hadn't been sick at all. So he's one of those who did not, he would have been, of course, asymptomatic other than the low-grade temperature, and they watched him. Child support still does a really fine job, so all of those numbers are, everything's doing well. I don't think, we're starting to see, we only have, I will say this, right now, we still have the front, if you've noticed, if you go by there, we now have an umbrella so that people are out there and it's warm, or it's inclement weather, they can stand under there. We have the 6 feet divide, and still have a lot of information that they can get outside in the small receptacles. And then we have lots of signage. We have about 24 to 25 people right now as our average on a week that we have to see for different reasons. But other than that, we try to equip them with what they need, and they don't have to come in. But we do operate that from 9 a.m. to 4 p.m. We clean from 8 to 9, and again from 4 to 5. And I mean, staff, I was really pleased. We had 2 ladies that got in the ladies' restroom literally last Friday. Friday's our cleaning day. We also clean every day, in the morning and the afternoons, basic cleaning, but we have heavy cleaning on Fridays. They cleaned the bathrooms from literally ceiling to floor. I mean, everything. We're just really trying not to have anybody sick at DSS. I can tell you that. None of us want that. We also, at the very end of that report, we include the nutrition and then homemade numbers. And I want you to see what has happened since July 2019 to July 2020. Now, of course, these numbers fluctuate based on people are placed. People have to go out for a while, maybe go rehab and then come home, and then unfortunately some others pass away. But we have increased steadily, slightly, a little bit all the time, but we're serving now 120 now, number of clients served in the nutrition. And you can see the difference in how many meals we're serving. We have continued, even though we're during COVID, the senior center's not open, we still do serve all the congregate clients as well. And everyone now is receiving, they're receiving frozen meals. So they would receive the frozen meals. We actually deliver, DSS staff delivers every day. So we'll get a route or 2 on Friday, those are delivered Monday. Mondays are delivered Tuesday. So every day they're being delivered. Now I've had a couple of complaints because they want the shelf-stable meals that had all the junk food in it. And we had to finally get away from that because I was like, there's nothing nutritional in this box. It is something that my husband would like to eat, and I would too, but we've got to get away from that. So we've gone back to the menu-driven meals, and they are frozen. We also received a little extra money from the CARES Act. And we are now we're starting to add all of those on from the assessments and all, and we're delivering to them. The meals are they have a little more in them. They are menu driven, but they are not, there's no caloric content or anything that has to be worried about, but it is menu driven. Some of the people are complaining about those because they are not as good as what they could drive through and get, but we are trying to help them stay indoors and social distance, and we have no one on a waiting list right now. Now, that's for meals. In homemade's another story. We've about filled up all our slots, but we're going to continue to look into that and see what else we can do. And do y'all have any questions for me? Well, if you don't, thank you again.
Thank you.
Thank you,
Thank you,
Stephanie.
Stephanie. Good job.
Okay, that looks like that completes our agenda for the Board of Health and Human Services. Any questions or comments from commissioners or from the Health Advisory Board? If not, do I have a motion to adjourn this meeting?
I'll make that motion.
Second.
Okay, Commissioner Cusco made the motion,
Second.
second by Commissioner Henson. All in favor?
Aye.
Okay, this meeting is adjourned.